Small business owners continue to monitor the health care reform movement in Washington. In his speech to the nation, President Obama again emphasized the cost of health care coverage on small business.
If you strike out on your own and start a small business, you'll be able to get coverage. We'll do this by creating a new insurance exchange, a marketplace where individuals and small businesses will be able to shop for health insurance at competitive prices. Now, for those individuals and small businesses who still can't afford the lower-priced insurance available in the exchange, we'll provide tax credits, the size of which will be based on your need. Likewise, businesses will be required to either offer their workers health care or chip in to help cover the cost of their workers. There will be a hardship waiver for those individuals who still can't afford coverage, and 95% of all small businesses, because of their size and narrow profit margin, would be exempt from these requirements.
Senator Mary Landrieu joins us again from Capitol Hill. She's the chairperson of the Senate Small Business Committee. Thanks so much for joining us again, Senator.
Thank you, JJ.
So what do you think is the most important thing small business owners should be looking for in any sort of proposal?
Well, what we're trying to do and advocating on behalf of the 27 million small businesses in America is to keep at a minimal any additional mandates or taxes on these businesses at this time. And this is going to be difficult because we do want to try to provide insurance reform and larger pools so small businesses like little hardware stores and cleaners and restaurants have the opportunity to provide quality, low-cost insurance to their workers just like the big businesses do. This has been something that businesses wanted for a long time, but the challenge is how to get that for them by reforming their markets and not raising their taxes too high, particularly at a time like this.
So there have been lots of things out there that says if you're a small business over a certain size, you have to provide health care coverage, or if you don't, you have to contribute some money to their health care coverage. What's your reaction to that?
Well, the House bill has come under a great deal of fire, and as you know, conservative, moderate Democrats, as well as some Republicans, have said we cannot go the way the House bill was taking us in terms of mandates on business. So we are trying to modify that approach, and that's one of the challenges that's before us right now in the Senate. So either it's exempting more businesses out or lowering that mandate or combining it, as the president did last night for the first time, saying individuals have responsibility as well. We're not just going to put these mandates on business, particularly small business, but individuals have to, get to the table as well. So we're trying to find a way, mostly for the small businesses, to give them the insurance, private insurance reform they need. Their people should not be dropped when they have a catastrophic situation. Their premiums cannot continue to go up 70% like they have in the last 40 years. Businesses know this, and that's why I think the business should stay at the table and work with us to see if we can find the right solutions for them.
Yeah, but what is the solution? How do you get health care costs low enough so that small business owners, most of whom really want to do the right thing and provide health insurance for their employees, how do you get those costs low enough so that they can actually pay for them?
Well, there are a couple of ways. Number one, if you can get more people covered, that will lower the cost because you've got more people in the program. And so it lowers the per unit cost the more volume you have. And right now, the problem with our system is we're going the opposite way. We have less and less people covered, so it becomes more and more expensive per person. So one of the goals, and businesses know this, that's why they've come to Congress, actually, to me and to others, and say, help us create our own pools. They know they want to do this and be able to expand. They want, though, to do it in a private sector model, not a public sector model, and that's what we're working on.
Senator, what's your opinion on the idea of a tax credit for businesses that are too small to provide health insurance or who need help with it?
Well, we're debating all those tax proposals now, but the bottom line is large companies have been for a long time in America able to write off their health insurance coverage. Small businesses couldn't do that. Now, a couple of years we made some adjustments and gave some additional credits, but what we're trying to do is figure out a way to expand coverage, lower cost, and provide equal tax credits to people in small businesses as in large businesses, and all do that without adding adding to the deficit. So this is not going to be easy, but it is necessary. Small businesses will tell you themselves, under the current system, they either are going to have to pay higher premiums or drop coverage, and that's not helping anyone.
All right. Well, Senator, obviously we're watching this very closely on this show, and all of our viewers are. So thank you so much for joining us.
Thank you.